morning.
Just go quite fast.
10 minutes. Okay. Yeah.
Don, you ready? Yeah. Call the meeting, Crawford County Commission order Friday, June 26, 2020. Begin with flag salute. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You've had a chance to look over previous meeting minutes. Any changes?
Mr. Chairman, I'll move we accept the minutes from the previous meeting. Second.
Aye. I guess signing the motions.
We got three motions from the last meeting to sign. The first motion is 20-262, that the consent agenda be approved. The next motion is 20-263, to approve payment of the invoices for the Gooding Tower and the Green Bush Tower as presented by 911 Director Tim Langford. And the last motion is 20-264, to approve the low bid of $4,641.74 from Pratt Corp. For the census map.
Thank you.
Thank you, Donald.
Thank you, Commissioners.
I guess, Mike, you want to be?
Sure.
Michael Ewing, Administrator for Health, Mental Health, and Juvenile Justice. Just want to remind commissioners and all department heads that the Mental Health Center will provide free therapy and counseling if anybody needs it in terms of your staff, and so just want to put that out there again, that's available to everybody, and just have a little gift bag for each of the commissioners for the job you guys have done, which is a coffee mug with Crawford County Health on it. So
Thank you. Thank you.
Take your lunch.
No, here you go. It's all right.
we got one here for you.
Man, those are slick. Thank you. Thank you, Mike.
And I'll just give you a copy of the letter that's going out to all the employees at Crawford County, all the departments. Also wrote a letter, or just kind of an email to our own staff in mental health, and trying to encourage people with all the uptick in cases, and I think it's kind of a slam as people's psyche, you know. But just to encourage people to roll with change. I mean, good grief. I mean, you can't settle too much on counting anything to remain the same. So then just encourage people, just as a matter of simplicity, to be aware of their own body and what they're feeling, and not allow fear to master them, but rather master the fear and focus on what they can control in their own life. And then just a simple reminder that when people get stressed, they tend to forget the most basic of things, because fear hijacks the thinking part of the brain, like eating healthy, walking, working out, praying, getting your sleep, connecting with family and friends. And one thing I'd just like to encourage people to do in the public is get off social media. I mean, you know, we get on it, you know, but I mean, honestly, it is just such a fire gas thing, you know, and it just inflames things. So, and in part because of fear and anger really does hijack our brain, and so, and when people just have that steady diet of that, overeating on it. So, the other thing is just to keep a routine. When we allow stress tends to disrupt our routines, and obviously we've been thrown out of our routines for the last 3 months, and so we're hardwired to basically have some structure in our life, and you have to find ways to do that. One thing, you know, I live south of town, and I do notice the sidewalk on Routh Street. I mean, that thing is packed with people. I mean, walking and doing, that's good stuff, and they're doing it with families, and that's good stuff, and we tend to forget some good stuff that's come out of this with families doing some things like that. So, and that's just another way of saying to normalize your life the best you can. You know, we mask up, we socially distance, and all those kind of things. We've survived three months of this disruption, and obviously I think we're going to have more of it. And Dr. Bean will have more to say about that. But anyway, I think the last thing is just encourage your employees here at the county, ask for help. You know, I mean, don't wait till you're too far down the pike to say, hey, this is just too much for me. I just need some help. So I've tried to do that even within our own agency with the Mental Health Center, because we catch the brunt of it, as does community health. The other thing I'd just like to say, in the last few days I've stopped in the health department just to sit in with the epi nurses and my lands. Those guys, they're doing a great job, and they're under a tremendous amount of stress. And I just like to tip my hat to them, the health department, but also the working relationship we've had with community health and the drive-through clinic. That has just been superb. So hats off to community health too on that engagement. So just wanted to remind people about taking care of the mental health needs, and that'll go out with all the PACE stubs coming out this next month. So at the end of this month. So I think that's all I've got. So I'll just turn it over to Dr. Bean to kind of give us an update.
Thank you.
Thank you, Mike.
Hi, thank you, and I really appreciate what Mike has to say, because I think this is a very polarizing topic in all the communities, and there are some that are very fearful, and then there are others that are not. And we, especially in the healthcare, we're really trying to find the balance and having evidence to support the decisions that we make and the recommendations that we make. And so we're working very hard, which evidence is very hard right now because everything is changing. And so we are, as a healthcare community, really trying to stay up on everything that we're learning about best practices. And that's what we're trying to implement. So give you a little bit of update what's going on in the county. I looked on the KDHE website. KDHE only updates the county numbers every Monday, Wednesday, Friday by 12:30. As of this morning, it had not been updated, so the numbers are still the same as Wednesday, which was up to 220. So that number will go up today when they do update those numbers. I can speak for community health and the testing that we have done since the beginning of June. We are sitting at 390 positives, but again, that is for all of our counties in southeast Kansas. A good chunk of those are Crawford County, or people that live or work in Crawford County. Via Christi, this morning they were reporting 3 positive admissions and 4 persons under investigation, so awaiting testing. They do have 1 patient on the ventilator. So not significantly different than what we've seen throughout this. Girard has no positives and no people currently under investigation. Pitt State said they just had 1 patient pending results. We are starting to see some cases pop up at other industries, and like Mike said, the epi nurses are working very hard. We are also working very well with KDHE. Had a call with them yesterday about having some additional resources for investigation, because, you know, looking at one case means talking to sometimes 20 different people, which is very time consuming to do it properly and thoroughly. So KDHE has been very good. They have added 100 new investigators to their staff to help us and are very concentrated on working with us to make this happen. So we feel like we're doing pretty good in all of those areas that we were looking for our criteria about making decisions. So those 4 criteria, again, just to remind everybody, increase in death, which fortunately we haven't had any, surging in the hospital that we can't handle, which we have not seen yet, being able to test, and then being able to investigate cases. So we are still able to meet all of those criteria. So at this point, really the recommendation is kind of what we've been saying. Definitely recommending masks in public, because we do think that can help reduce the spread. Encouraging those that are vulnerable for serious infection, so older people, specifically over the age of 55 or 60, or if you have serious health conditions, to stay home as much as possible. And distance yourself as much as possible, washing and sanitizing hands, and then most importantly, staying home if you are symptomatic. If you are sick and you feel like something is going on, stay home. One of the things I might mention too, because we are getting a lot of questions at the clinic about testing if you're asymptomatic, which there can be value in that. I don't necessarily think we need to recommend that everybody run in and get a test right now. Because remembering that a test is only one moment in time. And so we are definitely encouraging people with symptoms to be tested. And for people that are close contacts, especially if you live with or work with someone who is a known positive, there can be value in testing you even if you don't have symptoms. But that value goes up if you wait 5 to 7 days after you've been exposed. Because if you come in and get tested immediately after you found out that someone you live with is positive, that is likely going to be a negative test, because it can take 2 to 14 days for you to start to shed the virus enough to be detected.
You're actually better off than waiting
To wait,
4 to 5
yep,
days
yep.
after contact. Huh.
And a negative test does not keep you from needing to be quarantined. So if the health department tells you need to quarantine, even if you have a negative test, you still need to quarantine, because you can become positive and you can develop symptoms anytime in that 2-week time frame. So I think that's a misunderstanding that a lot of people have, and there's so much information, it's really hard to keep up on all of it. But that is something that I think I would like to really start making people aware that it is better to wait probably 5 to 7 days, staying isolated or quarantined if you're a close contact, before getting tested.
I hate
Thank
to
you.
do this.
No, I
Mr.
understand.
Chair, I have to attend a funeral.
Oh,
so
okay.
I'm going to have to go, but
That's fine.
thank you. I
Sure.
wanted to get the update, and I appreciate everything
No
you guys
problem.
do.
Do you guys have any other questions?
As far as testing capabilities, I've had some questions about just what does that look like as far as the number of tests that we have available or
Well,
access to them?
So right now, we are set well, I think, to meet the needs of the testing that we need to do. We have, in the community, we have enough supplies for testing. At Community Health, we've kind of been looking at it a week-by-week basis of what the community needs as far as the drive-through testing, and we are going to do drive-through testing next week every day from 8 to noon. So that's available, and we look at that week by week just based on what we need. So we will be able to continue to do that. So at this point, we can still meet the needs of the testing that we need to.
Okay. Do we know what it would look like where that would change?
If that were to change and we start having trouble getting test kits and things like that, we would probably most definitely we would prioritize symptomatic people over anybody else, because that's when potentially it could change. The whole reason for testing is to help direct our recommendations for treatment. this is for anything, for treatment or for, in this case, isolation and quarantine. And so hospitals, testing people coming in, very important because that can change their treatment in the hospital and certainly their protection measures that they put into place in the hospital. So in the event that we would need to start changing our testing requirements, we would focus on the hospital and symptomatic people.
Gotcha.
So,
So you'd answer the contact tracing thing, because it had sounded like so we had the recovery task force meeting yesterday where it kind of sounded like that there was some strain on that, but that is not the case as of right now, or?
that is correct. So Rebecca and Michael and I and the epi nurses were on a call with KDHE after that recovery meeting, and KDHE definitely answered some questions and put some measures in place to help with that. So at this point,
Good.
we're good.
Cool. So you mentioned that there was a person on a ventilator. I've had some questions about, do we know the number of ventilators we have for the county?
I cannot tell you that off the top of my head, but I can certainly get that information and we can provide that Tuesday. We can get a copy of that from both Gerard and from Via Christi. Happy to do that.
Okay, cool. And then as far as the increasing cases, like they're not at this point now solely from the food plant, like they're elsewhere?
I can't answer that exactly. It's definitely people in the community outside of the food plant, but we don't have the investigation of each case takes a little bit of time, and I think we talked about this a little bit yesterday. To determine if it's community spread, basically what that means is you can't trace it back to a source. That you do the investigation and you can't really determine where the person was exposed. That's when they deem it community spread. And I think it's too early for us to be able to say that because we are still investigating all of the cases. To this point, most of the cases we have been able to pinpoint it back to, and not all of it goes back to the one food plant. Some of it is from, outside exposures from other people coming in and family members and things like that. So still a little early for us to be able to say for sure.
So I know Community Health has been doing this serology testing.
The antibody testing.
Right,
Mhm.
yes. So what kind of scale has that been on?
Nothing compared to the COVID testing. And that's a good point for us to talk about because I think there is some confusion too about what antibody testing tells us. So antibody testing in no way can help us diagnose right now. It is a look back to say that, so when someone is exposed to an infection, their body mounts an immune response, and that can be seen in antibodies. Depending on the person and depending on the virus, sometimes that can take a few days, sometimes that can take a few weeks. And so there is antibody testing available for COVID-19. And, the recommendation that we are giving is to only really test for that if you are farther out than 2 weeks from symptoms. So what we have seen, a lot of people feel like maybe they had the COVID infection before we were really testing for it, like back in February. And so we had some people come in that were tested for antibodies. We have had very few positives, and the positives that we have had have been linked to families that were known positive. So the general, and again, this has been a really pretty small sample in the community because we haven't really done a lot of this. The majority of it has been negative, which tells me we really haven't had it before now. But again, that's a very small sample, but it really is not a substitution for the COVID test, which is what we're doing for active infection.
Well, I know that Rebecca had said that the health department had gotten the grant to do population-wide antibody testing. Do you know where we are in that process? Have you heard?
I don't know the details about the plans for starting that. Again, that is a little bit more of a kind of our surveillance thing. And so I suspect we may do more of that as we get through the wave of increasing positives, because what that can do is it can go back and help you look to see the potential of people that were immune and didn't know they had been infected. Honestly, we don't really know what the implication of that is, because we don't know enough about this to know whether if you test positive for antibodies, you can't get it again.
Right.
We don't know that how long people are immune. There's still so many unknowns about that. So it is a tool to help us understand kind of what's going on in a person and what's going on in a community, but we don't know enough about it to be able to say, this means we are safe, or this means...
Correct.
So it's just a tool for us to understand.
Right. Cool, thank you for that explanation.
Sure.
That's all. I think that's all the questions I had.
Okay.
And it's safe to say that most people that do have it right now are doing, I know you said one on a ventilator, but most people are.
Sure. I think for the
Responding
volume
well.
of positive cases that we have, I've been very pleased to see that it's been pretty mild illness,
Okay.
which is partly why we continue to recommend what we're recommending. But we are keeping a very close eye on more serious infection. I think outpatient clinics certainly see that, and we have not seen a surge of a lot of people coming in, not doing well. And then the hospitals and ERs, definitely keeping a very close eye on that. But so far, fortunately, most have recovered at home without incident.
That's good.
Yep.
And the age spectrum, it's pretty much across the board.
I don't know. KDHE does break it down by age, so when they update their numbers, that you will be able to kind of see the percentage of AIDS. I think age, it is kind of across the board.
On the hospital numbers, because I know they report on the COVID cases, are we also looking at, because we're also looking at the number of people in the hospital generally, right? Because that's the indicator. Are they reporting those numbers as well?
I don't have those numbers specifically. We didn't specifically talk about the overall numbers. Historically, in the summertime, census in the hospitals are typically lower, and I think my impression from the hospitals is that they're pretty much on par with what they normally see at this time of year. But again, we can get more specific numbers on just hospital numbers in general.
I would be interested in that context.
Yep.
Because I know that when we talk about overwhelming the healthcare system, it's
It could
not
be
just
just-
people with
yes,
COVID, it's
right.
also all the
Absolutely.
other things that's the danger. So.
Right. And there have been, all along in the planning, emergency planning for this from the very beginning, talking about how to be able to continue to manage the non-COVID cases with an expected surge. And so the hospitals, both hospitals in Crawford County have been working together to figure that out together, so.
I think that's all I've got.
All right.
Thank you very much.
Thank
Cool.
you.
Thank you, Dr. Mead.
All right. Anything else? Rusty? All right. Thank you very much.
Sure.
Thanks for the update. Have a good day. Have a good weekend.
Yeah, thank you, guys.
All right. Jim, do you want to go ahead and, you want to just cover that under old business? You want to go through new business real quick?
Sure.
You want to go ahead? Okay. Judge, did you need, were you wanting to talk to us
No,
too?
I just want to catch you guys and see where, if I can commandeer the third floor to set it up for, with social distancing. I just wasn't, I didn't realize we were having a meeting, so I was just
No,
gonna come
that's
down and
fine.
catch Don. But, I just want to be able to set up the barriers for people to be 6 feet apart like they have down here on the second floor and
You bet.
signage up. So I just wanted to verify that's all right.
Yep.
Yeah, that would be great.
All right. Thank you very much.
All right, thank you.
Thanks.
All right, Jim.
Okay.
Regarding the sanitation bids, hopefully this will be, get everything straight here. Let me hand out, I've got a new handout. I did send this out to the commissioners yesterday to review,
Yep.
along with the resolution. As Commissioner Johnson had said, Tuesday, we do, earlier this year, we passed a local preference percentage on bids. After reviewing that, resolution Wednesday, one that does apply here, and two that is 5%. So I had said 3% in the meeting, that was not correct. So I added a 5% column to the end, and that applies to WCA's bid only as an out-of-town, as an out-of-county business with the business location in Joplin. So you can see what that does to their bid, adding the 5%. It keeps them as the low bid on every item except at the sheriff's department. For the sheriff's department bid, their bid will move to 316.05, and McClellan then will be low bid pursuant to the resolution at 312. So, yeah, that clears everything up, I think, as far as our locations. We've set a pretty aggressive date, July 1st, and I know everybody's
Oh, man.
trying to get on board for
Okay.
that, so hopefully we won't lose any trash in the process, but yeah, I know Dave here is ready. He's been talking to me a couple times and is getting some things ordered, so I know he'll be ready to go. And some of the couple places we might need to make do in the short term, but eventually we'll get up and running to everything we need, so.
We should be able to have everything very much like
Okay, perfect.
there was, I had a question, kind of, you want me to come up there?
Yes, please.
That might be helpful.
Yes, go ahead.
Of course, when we first got the bid, in the mail to do the bid, the way I read it was whoever was the lowest bidder overall got all of it. That was my understanding. So that's the way I bid it.
Okay.
And you can see the total, I'm lower on the total on everything. And if you add 5% to WCA, if I had the ones in yellow that WCA has, my total would be, it'd only make like $11 or $12 difference. I don't want to be $11 or $12 on those 1, 2, 3, 4, not counting the jail. 4 of them, I'd only be like $11 or $12 total on those 4,
Right.
higher.
I mean, will,
And so I said the last time that I didn't know if I wanted to go to Pittsburgh, but since we got most of it,
You're gonna be
I'm
going.
willing to do
Might
it.
as well.
But I'd like to have them all.
The way,
The way I read the bid, I thought the lowest bidder overall total would get them all. That's what I
And
thought.
I didn't read that bid packet to see how
the
that.
way we set it up was, and I thought about bidding out total bid and just putting one line and having you bid all of it. But I wanted to keep it separate in case, there was one area, the Gerard and Pittsburgh area, just in case it ended up splitting out separate. We could bid it separate. And that's why I had everybody bid each line. It's set up to bid each line so that, we can award more than one, more than one bidder. That's why I set it up
Okay,
that way.
well, I kinda thought you wanted it all to be one hauler, so you just have to deal with
Simplify it.
Right,
one hauler.
yeah.
It's kinda, that's kinda what I thought. I think Tim kinda thought the same thing.
Do you think you're getting the whole package?
No, I know y'all made a tree a little bit, you've been harder, you didn't have to bid on it, all right? I understood that going.
Yes, sir, yes.
I understood that,
We were bidding each spot.
but there's a different way to calculate this. When you don't know what he wants, I don't know if you realize it yet. I didn't know that. I didn't realize it was 5% lower than this part. I thought it was 3%, so I run my numbers at 3%.
Well,
That's when
we-
I didn't know, that's when I didn't know who was going to bid for.
Right.
That's fine. As
Right.
far as I'm concerned, he's won all. You know, I didn't look at it individually. If you take the bottom number on WCA, you add your 5%, I'm betting he's gonna be lower overall.
Right, I mean, he's already the lowest.
He's already low.
$100.
And as far as, you had us bid on the
Take that
roll.
bottom number, that's gonna catch him whether 1, 2, or 3, whatever it is he's talking about, and throw it all in the,
Right.
if you use the bottom number.
If we
You have to use the total to do it.
And as far as roll-offs, I bid that, but I think Tim was lower
He
on the
is
roll-off,
lower.
and I don't even, I mean, I would do a roll-off for you if you want to, but this is more what I want, rather than the roll-offs. And if you wanted to
Okay.
call Tim for roll-offs, I don't
Well,
even
they
have
weren't-
40 yards, I have 30 yards, I'd be glad to do one
And
for
they
you
weren't-
if you want me
they
to.
We're
weren't-
a little bit on the roll off, so we can call them shorts.
And they weren't, I mean, it wasn't on this list, it was separate.
It was a
route
separate,
anyway.
yeah, but they are a little bit, I read those Tuesday.
Okay.
And I'm good with, if, you know, if we could do,
Well-
just get all of it, and Tim gets the roll-off. And that puts,
I mean, now,
WCA, they're not really.
I guess you gotta give some advice here, but it's kinda like what we're doing with Croc in. I'd like to simplify everything we can as much as possible.
Exactly,
And if,
right.
and I can see your point, if you
And-
think you're
well, it
bidding the
says
whole, which
on-
I could see that, and I see it both ways. Since it's spread out.
And on the bid thing, it says that you have the right to refuse or reject
We do.
any or all bids.
We
Right.
did, there's leeway for the commission, if
Okay.
you'd like to look at it that way.
So do you have the language from the bid thing that was sent out? I would like to review that.
I've read it over 2 or 3 times, and it doesn't say in there that you, each individual one, so I just assumed that it was the lowest bid total overall.
Right, and oftentimes that
I'm not
is
trying
how
to
it's
cause
done.
trouble or anything, but I just,
No, not at all.
You're fine, you're fine, we're just,
Well, when I thought he wanted for Pittsburgh, I was going back to the office and started calculating me versus WCA.
right.
Well, the only way-
For him, I made it for 94 cents.
the only way
It wasn't much.
what I meant before was, if I don't go to Pittsburgh, I don't want any of Pittsburgh, but I want all of Gerard.
Right.
But it, you know,
Yeah.
we got most everything in Pittsburgh.
Right, yeah.
Hired, went over,
Well,
had the
that's-
truck inspected, and
we
got a
can't
city
speak for the
license.
other company,
We've already
but
done that, so all we gotta
two-
do now is
two
deliver
locations.
containers, and we can probably have all of them.
That's
I
awesome.
called my container person, and they said whatever day I order them, I should be able to have them next day.
Here's a total, this is WCA bid form and upload pages on it. And it's 2 separate sheets, but here's what the bid form and then.
And Jim, I did check on that one we talked about, where there was a 4-yard, 3 days a week.
Yes.
There's plenty of room there for a 6-yard.
Oh, good.
To do it twice a week, so then I would only, if I did that the way it shows on there, I'd have to go to Pittsburgh 4 days a week. Change that one,
I'm good with
6-yard to a 4-yard, then I only gotta go a little bit times.
You can see the language on actual bid page. I did that, please bid price per location in the space provided in the table above. So that is what we asked for.
Yeah, price per location, but we thought it was gonna be the total of all locations added together, whoever was.
Would you have bid it differently? Like, would your numbers look different if you had known?
Probably not really, but, you know, maybe. Probably not much different. I just figured the lowest bidder overall would get them all. And that, one at the judicial center is actually a 3. Did you see that?
I have a hard time going for it, you know, that presentation, I'm pretty sure.
Well, it's on wheels, I'm pretty sure it's 3.
I've got 4.
Well, I don't have any 4s on wheels, but I've seen them.
Yeah, I got one.
Okay.
Anyway, I guess it's up to you guys now.
I mean, Tim, would you guys have bid differently if it had been
Probably.
specified? You don't think it would have?
I mean, you've got to go down, you've got to go down and make it the price of the one.
Right.
All the day weeks and all the days weeks. So you just figure in based off. how many-
Right. And I can see where one
You gotta
person,
do-
one
Yeah.
person, if you're not interested in a certain area, you bid it high. If you get it, then you get it. If you don't, you don't.
No.
I mean, if you gotta travel clear across the county to get it, what's the point unless you're gonna be in that town
Well,
anyway?
I think that.
You gotta bid them all separate
Yeah.
to get that total number.
To get the number right.
Yeah, you got to bid them all separate, get the total number. The only reason I brought the total number is that it's a way for y'all to look at.
Yeah, no, I agree.
That will get you into where you can get a hold. And I understand the idea of having one company. I don't
Yeah.
think they will agree. You know, so, I'm with you on that part.
Well, that's kind
I
of what
understand.
we're doing with the phone systems. It doesn't make sense to have every office to have its own phone bill when we pay them all anyway. It should be just one thing. We can regulate that one thing.
And I wasn't
Simplify
sure
it.
if this bid was the bill came to y'all or when it was individual. I wasn't sure.
It's kind of both ways.
Yeah.
I think it's both ways.
Both
Right.
ways.
So I was gonna ask the y'all if I got.
Right.
Yeah, we can split up. It's all-
Did
it's
any,
no problem.
did anybody
Well,
from ECA or even get a hold of you?
That's the other thing. I mean,
I've heard that.
if you haven't heard anything from them,
No.
I'm fine using the
They're
bottom
hard to
number.
get a hold of anyway.
I know. Well, that's one reason why this process took so long to start.
Right.
Yes, it did. Yeah, and we are cutting it close.
So if the bottom number is okay for us to use and we have somebody that's willing to do all of it, I'm okay with doing it that way.
I think so too, yeah.
Okay.
Okay.
I don't have
I
a
mean, to
problem
me,
with
that's
that.
up to the commissioner's
Okay.
discretion.
No, that's fine. I mean,
Well, it says in there you can.
Accept or
We're trying to-
accept or
we're trying to simplify
reject
it.
any bid.
Get your options.
That's why we put it in there.
we're trying to simplify some processes, and that's
Right, and
that's the
like I
whole
said,
purpose.
This is our first go around.
Yeah.
We were, with the 2 different locations, it makes it different. I know for like Pittsburgh, there's been Pittsburgh area, so I can see they're only taking one bid. I just thought it might be different with us having Pittsburgh area.
Yeah. Okay.
So, yeah,
We can do it.
that's fine.
All right.
Yeah. I
We've
would
been,
recommend that then.
Okay.
Just go with the total.
We've been locally owned and family operated since 1964. So I was 8 years old, so 64
Business
now.
owner a long
I'm
time.
starting to learn how to do it.
I mean, you got it figured out already?
I don't have it all figured out, but I'm getting better at it.
All right. So
Okay. We'll plan on doing all of it.
okay.
Okay.
So I guess if that simplifies, yeah, I'll make a motion to approve the sanitation services for this list. I don't know what you want to call it, the facility receptacle locations.
Yes.
To McClellan, price of $14,1050. And
And then we'll
likewise,
also-
make a motion for
Also need
the
to add in short.
30 and 40
For
yard,
the
Can that
30
be part of this same motion?
Yes.
Okay.
30 and 40
Put it
yard
all together.
dumpsters to
Right, and that's at
short
$150.
sanitation.
Okay, I'll second.
Thank you very much for, I know it takes time to do. Okay, so now we'll get back to,
Okay, I'll let both parties know.
All right. all right, thank you very much.
All right.
Thanks, Jim.
Dawn, do you have any new business? Sorry, we
I do.
jumped ahead of everything, but I figured they may have place to be.
Thank you.
I just wanted to make sure you all had a copy of this notice of hearing from the city of Pittsburgh. They're establishing another one of those rural housing incentive districts.
Okay.
I think this will be their third. And, you know, just, it's going in out south of PHS off of, to the west of Free Kings Highway there, kind of about where the Pittsburgh water plant is. So, looks like another good development. They're gonna get scheduled anyway to be built. And I wanted to make sure you guys were aware of that. We do have kind of a right to object to it if we think it's not in the best interest of the county or things like that. But it's anyway, wanted to make sure you guys had a copy of that. I have the full notice here that includes a map of the area and things like that, and I'll put it in so you guys can look through that. But and it's actually their resolution that they're considering that they would pass to establish that RHID. So just wanted you guys to be aware of that. Make sure you all had that documentation.
All right, well, thank you.
Thanks, Tom.
Anything else?
I don't for new business.
Jim, you're up again.
Yes, I just want to talk some scheduling maybe for the next
Yeah.
week, couple of weeks. I've had a request from Tim Mykert requesting a work session at 9 o'clock Tuesday. We have a 9:30 already on the books.
Okay.
He's doing, and yeah, we had that couple invoices from Tuesday. He just wants to explain some of the work he's doing, sit down and just let you know everything he's doing for these antennas, because he will have some more
So 9 o'clock.
invoices come up.
On the
So he would
30th?
like to do that on the 30th at 9, and then we'll have an agenda, but we have another one on for 9:30.
Yeah, we
Talk
do
about our
that
CDBG CV plan.
work session.
Okay.
And then we talked Tuesday about just planning ahead for rock availability,
Mm-hmm.
when the turbines get going. So I've talked to Steve Sloan with Midwest Minerals, and then also talked to Mulberry Limestone, Matt Blesson. Steve can be available July 7th, 9 or 9:30, whenever you'd like him. And I think I can also get Matt there. Matt didn't seem to think it would be an issue for his business, but we might be able to get them both here. But I know we'll at least have Steve here at either 9 or 9:30.
So it shouldn't take that long.
I don't think it should either.
9:30 should be plenty of time, right?
9:30, okay.
So that'd be Midwest Mineral and Mulberry Limestone.
That's July 7th?
Yes.
We're doing that, okay.
And the only other thing that I want to bring up is, I've talked to Randy a couple of times, and she has had a presentation from a vendor, a separate vendor from Bucati that is interested in looking at basically starting from scratch, and I think they had just finished that in Miami County, starting from scratch, make sure we got our job descriptions, make sure they're up to date, some of them even completed, and then go through and do your pay scale, your pay study, get that set up. Also look at the handbook. She thought it was a very positive meeting, and the gentleman would like to come down actually to a work session. And the only thing that I know is gonna start happening is budget work sessions. We will have to start doing, so I did not know. He'd be available the 14th or the 21st of July. He's got about an hour presentation. But I didn't know if we wanted to push him back a month, knowing that we're gonna start looking at budgets, or whatever the commission, whatever you guys think.
It doesn't matter.
Yeah, I mean,
Do you know, Don, when we'll be ready to start?
I mean, I would think next week, to start, I mean, we could look at it in the meeting.
Okay.
I need to, we will have to really wait for the, kind of first draft of our audit, which, Terry serves, so that kind of ties out our beginning balances for this year as far as, fund cash balances. And then that way you're not having to adjust later for, if they arrive at a different cash balance for one of our funds. And he indicated, they were in here a week before last, and, that he would have those to me in the next couple of weeks, which would be like next week. I should be getting that from him.
Okay.
Okay.
I'll reach out to him, make sure we're gonna have that, but, I mean, we can also start just kind of reviewing how, Christy Mitchell, our Blue Cross and Blue Shield, I reached out to her, and she's supposed to have us kind of an estimate of what our Blue Cross looks like, or the, health insurance premiums look like for next year. She's wants to set up a time. She hadn't got that run yet, but she wants to set up a time to come over and review that with us, which that is a big impact on our budget. Is most of our employee benefits fund, their expenditures are on health insurance. So yeah, I mean, we can start looking at segments of it. We may not have it all put together next week, but we can look at what you guys have already seen from the department heads, and kind of get that all into a schedule that shows what kind of increases we're looking at. Said I know values are up about 2%, property values countywide. We did have some new construction over the last year, so that will help. And we're still trying to figure out what's going to happen with sales taxes. This year, they've not really haven't changed hardly any from what they were last year. They were up just a little bit, in fact. But I mean, we thought the deposit we got this month would be down a little bit, but it wasn't. So, trying to figure out what our revenues are going to be for next year is always kind of a crystal ball type thing. But they hopefully we won't have to look at really decreased revenues. We know, casino revenues are down this year, and that's not a big part of our budget. I mean, sales tax is
Right.
a lot more of our revenues there, so. We'll have to start breaking it down here in the next.
So you thinking 14th, 21st,
How about we schedule for the 14th at 9 o'clock, and then if
9 o'clock?
If it doesn't happen, we can reschedule, and I'll see if Randy can't get some information out to everybody
And that's with Katie?
ahead of time. That is not with
That's with
Bucati.
a different
Arnold?
firm.
Arnold,
Is that
that
the
is
name of
with
it?
Arnold,
Arnold?
yeah. There's probably more to that, but Arnold is what
Okay.
I've heard, so.
All right.
Yeah, we'll get them here. And then I think the only other thing, and Don, you maybe, I know we've had a couple emails about it, but I guess there's a video at 3.
Yeah, 3 this afternoon,
Yes.
that was gonna be my whole business.
Okay, I'll let you
Make
talk
sure
about that,
everybody was
Don.
aware that
Right. I know NACO was gonna have a video at noon, but I
Oh,
think
really?
KC is probably gonna be better.
Mm.
I saw an email yesterday about a NACO presentation. at
I had not
noon.
seen that one.
Maybe I'll look, maybe I can see if I can get that.
Okay,
That's all I.
cool. Thanks, Jim.
Jeremy?
I had a few things to talk about. Okay, so first off, I think Bruce, you had said you'd seen the letter from Southeast Kansas Recycling on the requesting to set up a joint committee with the city and the county to discuss a plan for continued financial support of the recycling center. Obviously, I'm on the board, and so they had talked about doing that. I abstained from sending it forward. I think it's a good idea, since kind of traditionally the county has been like, it's been a factor. The city has kicked in some stuff, but I
Right.
think that the city sees a lot of benefit from it as well, and so they're interested in setting up a committee made up of both entities to talk about some kind of funding plan jointly going forward. So I think the city commission is going to be voting on something similar to.
Okay.
To
So how many
set this up.
representative, what are they trying to?
I don't know that they had anything specifically. I think that they were, just looking for representatives from both entities to sit on it.
How would we do that? I mean, does,
I don't know that they had a number in mind. I mean, I would feel comfortable doing that and maybe having another person, whether you or, I don't know who.
That'd be fine. I mean, I would do that if you like to.
Okay.
Well, I'll talk to Jim Triplett and see if he had some more specific ideas of number and what they wanted that to look like. I mean, I think it would be useful to get both us, the city in the room and talk about, like, you know, what is support going to look like and how is that shared across the two main entities that bear responsibility and benefit from it.
yeah.
So I'll talk to him and get more details and then bring that back. So on Wednesday, on Thursdays, the Crawford County Recovery Task Force meets that made up of like people from the city and myself and the healthcare system and the county and Girard and just a bunch of people involved in that. I also sit on this subcommittee that's like government relations and funding discussion, and so the CARES Act money has been a lot of that discussion. I know we had kind of talked about what we're gonna try to do to prepare for that. It seemed like kind of the discussion in the group was headed in this direction. Like it could include further people, but it's kind of an already set up thing that might be a good place to discuss like what priorities for that money look like. And as we get more details, hopefully this afternoon, we'll kind of know what the expectations are and how we want to go about spending that. But that, I mean, so right now on that committee, it's made up of, it's not wholly representative, but has people from the city of Pittsburgh and the university, and there's supposed to be, I think it was Joanna Winter from Girard, and I don't know that we had someone from Frontenac yet or ARM on there, but I believe that they were to be included, but have kind of a representation of the community, the different communities as we're talking about what that would look like and kind of what the best ways to spend that money might be.
So have they determined what requirements are for that allocation yet? Or is
I
that
don't
what-
think so. All we know, I think, is that we're gonna get around $8 million, that we're gonna have to spend it by October 1st.
And this goes to the local governments,
it's-
cities?
My impression
and
was it would go to
school
us and we
districts?
would disperse it
Okay.
to the other ones, but we've not heard any of the requirements of like how much needs to go, if there are requirements, if we determine, like there's not been any,
But this would be money to be,
Indication.
could be available to school districts?
right. So
Yes.
this money is supposed to be used by local units of government, so us, the municipalities, and
The schools.
the schools.
Schools.
Yes.
Perfect.
And then there will be a second round that would come out in like August, I think, that would focus on economic development that private entities could also apply for then.
So there's a teleconference regarding that?
Today at 3,
Today at
is
3?
it the Kansas Association of Counties
Yeah.
that's hosting that?
Yes.
They, along with that office.
Oh, and it was the Spark office, yes,
Yeah,
that's
the
heading that
governor's
up.
office there.
Right.
Right.
And then I saw Monica had texted me that the Spark Committee is supposed to meet again on Tuesday, and she thought that they would be broadcasting
Oh, good.
their meeting. So hopefully between today's thing and Tuesday, there will be some further detail. But I think because the indication has been there's going to be a really fast turnaround, because the state will because it's federal money, the state will have had to have spent it by the end of the year, so they're wanting it back before the end of the year, so
Right.
they can, if it's
Funnel it
unspent.
into another
So are you
Right.
foreseeing
phase 2 and 3.
a
Right.
list of acceptable expenditures? Is that
It's
kind
so,
of,
so far, the only criteria have been from the Treasury Department, and it's like stupidly broad. Like, it's like anything related to coronavirus, like,
Yeah.
We're supposed to
it's
get,
unhelpful.
we're supposed to get a toolkit maybe today, or they mentioned that in this email. We're supposed to be getting some guidelines
Okay.
on what you can spend it on. Some counties have hired a consultant firm to kind of manage the money, and kind of take some of the burden off of the county. I've seen some of the counties have actually hired a firm, so we may have to look into that too, but there's a lot going on in a short time,
Right.
and with not a whole lot of guidance yet. So I'm
They
hoping
put out
it comes
that
up.
sample resolution.
Yes, I've been working on that.
yesterday,
Right.
And that did have some language in it about some of the stuff that was.
Yes.
I was gonna pull that up, and still had language in there about unemployment
Yes.
payments from businesses. I don't know if businesses would apply
Really?
to us.
Oh, yeah.
Oh, I remember reading that we could give it to businesses
Yeah.
through like a grant process or
Yes.
something, or. Like I said, there's been like no guidance.
There's no guidance, and it's a lot of money, and we really have to be on our toes
Right.
on
Okay.
this.
A lot of counties are kind of hiring somebody, I don't know, accounting or somebody who's knowledgeable in federal grants as well to make sure that they're hitting all the things. Here goes our public health expenditures related to hospitals and clinics. You know, payroll of employees that have been, doing testing and mitigation, things like that, technology improvements for distance learning, improving telework capabilities, but then that unemployment insurance cost related
That's
to
interesting.
COVID-19. And that was sounded like from the meeting of the legislative council, that they wanted if you have any employers around here who experienced an increase in their unemployment insurance costs, that they could apply for that. I'm not sure that it's pretty vague there. I
Right.
mean, as to who.
Right, so hopefully they'll have more information today
Okay.
or by Tuesday.
Right.
We're getting calls about it. I've had a call
Yeah.
from a school district yesterday.
So did I.
It's
That's
kind
what
of
I was
taking the
curious.
lead for all the school districts and wondering about, they'd like to gear up before school starts.
Right.
and-
Right.
And purchase some items. I'm like,
Mhm.
well, that would seem like it would work, but I can't tell you yes or no. Yeah, so
Right.
maybe I can tell you later today or be able to send them something, so.
Yeah.
Right.
Hopefully we'll.
Is that something that they can listen in through today?
I think that's only for, the way I read it, it was for counties.
Yeah,
Okay.
I think it was
That's fine, I'm just
mostly
curious.
designed for, because that's where the money's gonna go to first, is to the county,
Right.
and then they'll be
Well,
distributing it.
I'll
to
update them and let
whoever.
them know that
Yeah, we can share any
we'll know
information
more
we get.
hopefully Tuesday.
So, yeah.
Right, and I'm supposed to meet with that committee, the Government Liaison and Funding Committee, on Monday to
Okay.
kind of update
Okay.
them from what we hear here, and then maybe more on Tuesday, it sounds like.
Right.
I know one of the things that had kind of come up was messaging is gonna be a lot of it, whether through, public health stuff of like, you need to wear a mask, you need to stay home, you need to, like, all of those kinds of things.
Yes.
But also on kind of reporting from the health department and updates on coronavirus that I think a lot, like, so like the city and PSU have dedicated communications, PR people working on that, but I think that they are interested in having some of that from us, and we don't have that kind of person. And so one of the things they talked about, that they were going to work on getting like a kind of a list of what would be helpful to have from the county to us that potentially we could use
Okay.
this kind of stuff to set up. Whether like a contract, they had suggested like working with Limelight Marketing, who can do, can outsource basically, so you're not like hiring a person to do that, but have some of those things of what would be helpful, because like right now the discussion is like, could the City of Pittsburgh person have access to the Crawford County Health Department Facebook page? Like, that's kind of a problem, right?
Right.
Like, it's not ideal. So having something like that we could discuss what that would look like. So there is consistent but also regular messaging, because right now it's like the people that are responsible for overseeing the testing and actually doing the stuff are also the ones updating the messaging, which is not super helpful in the middle of a crisis.
Right, especially when they're swamped. Just trying to do
Right
their
now,
job.
when they have
So
a
it's
ton
hard.
of cases and a bunch of stuff to
Yes.
do, you don't want to take time to also like, all right, now I need to update the Facebook page about how many we have. Like that's,
Yes.
it's impractical. So
Right.
that's been part of the conversation as well.
Okay.
So it sounds like we have kind of the workings of some kind of collaborative or discussion group of what that might be going forward.
Good.
Once we have details about what it'll look like.
Let's get those details.
The details is the kicker, yeah. We know it's $8 million. We know we need to spend it by October. Not much more than that.
Yeah.
We need help with that.
Yeah, lots of people are like, "Ooh, me! I can I can help you spend $8 million."
Part of that too. Well, yeah, for everything, you have trouble getting around.
We'll be sure. We have your contact info. We'll hit you up. So the last thing I wanted to talk about that came up in the recovery task force meeting yesterday. So the Dev Squared, the local software development company, had been working on the contact tracing app, but then there had been, was it the federal legislation that basically outlawed contact tracing apps that use GPS stuff, I believe, which was like the whole thing, so that's not going to work. However, there is a group out of Lawrence that is run by Brian McClendon, who ran for Secretary of State in 2018, and he's done some software stuff. Like, it was his group that had done the KS Votes website that helped
He
register
basically,
people to-
he started Google Maps and that was
Right.
where he made his money and retired young, back to Lawrence.
Right, I think he's
Yeah.
working for the University of Kansas as like a researcher and professor. So he and it sounds like other software folks up there are putting something together called CV Key. So it is not a contact tracing app. It focuses instead on like pushing out information to the public on local guidelines. So like it would, similar to the Crawford County check-in thing, like would be managed by local, what are called communities. So like large organizations could do it, or like a county could do it. And then setting up guidelines for specific like locations. So like you could have criteria set out for like, this is what you need to do when you go to a grocery store, or like if like PSU could set up specific questions that they could ask, like a screening kind of process that again would not use GPS stuff. It would be voluntary. So like local businesses or organizations would primarily be the ones doing it. It would not be like a thing pushed down from the top onto people. But then also it would also have like the QR code type of thing where you could scan it when you go in, and it would push out criteria to you basically to be like, you need to, if coming into this place you need to wear a mask, you need to screen for temperature and symptoms, that kind of stuff. And it sounded like that they were I don't know that they had statewide endorsement, but it sounded like the group would be willing to, they were wanting to do some beta testing with them and use that in the place of the Crawford County check-in one, since that won't be viable. So it sounds like they're gonna be looking into bringing them down and trying that out here pretty soon.
Okay.
I think that's all I had for new business.
All right. I don't have anything, so Don, old business?
Yeah, just basically wanted to say we will have the Zoom meeting for that, CARES Act, the information this afternoon here in the office. But if any of you want to do it somewhere else, I've got the link.
Okay.
I can send it out to you, or you can, just dial in and listen as well. There's a phone number there. But, hopefully we get some more kind of detailed information, not just kind of general guidelines.
We've got the general stuff,
Yeah.
we need the specifics.
Because I think that resolution is gonna carry with it some, kind of potential liability if there are, if that money is not used for the purposes that are prescribed, by that law or by the guidelines, that you could be in trouble down the line.
Okay.
We'll be here ready to listen and learn.
Hopefully.
Yes.
Jim? Jeremy?
I don't think I have any old business.
Me either. Okay, so, did I miss anyone? Future business? A lot of things on here. June 30th, 8 a.m. work session to review and sign June bills and payroll vouchers. Also on June 30th, we'll have a 9 a.m. work session with Tim Mykert and a 9:30 work session to discuss this CDBG CV plan. On July 3rd, the courthouse will be closed in observance of the Independence Day holiday, and regular session for that day is canceled. July 7th, I guess that's a work session too, isn't it? July 7th, we'll have a work session. What time do you want to have that one? 9:30 with Midwest Mineral and Mulberry Limestone. And then on July 14th, we'll have a 9 a.m. work session with Arnold. Is that all I need? And like it's been going, the courthouse in Jordan is open to the public from 8 a.m. to 4 p.m. starting June 1st until further notice. The motor vehicle office at the Judicial Center in Pittsburgh will remain closed, but residents may use the drop box at the security desk at the Judicial Center for motor vehicle and tax payments to be processed at the courthouse. Any other business?
If there's no other business to come before the commission, I will move that we adjourn.
All right.